Welcome to another episode of MaxLiving Radio. My name is Dr. Jake Tucker, and I'm the owner here at Good Life Family Chiropractic. And we're recording live here in Good Life Family Chiropractic Studios. And I'm coming to you today talking about something that may be at the root cause of virtually every chronic health condition in the United States of America today. And so if you're suffering from heart disease, or it runs in your family, or cancer, or it runs in your family, or diabetes, or it runs in your family, then listen up, because those are the most deadly conditions in the United States. And odds are, if you're like most Americans, that you will die of one of those top two diseases there, heart disease or cancer, and that it will be affected by it, whether or not you get diabetes. And I've talked a lot on this show about specifically the role that nutrition and that fitness, that toxicity play into these. But what I want to talk to you about today is something called cervical degenerative myelopathy. And cervical degenerative myelopathy is a new condition. It's something that was just recently coined in the neuroscience literature just a few years ago, because what they were finding is that people with something called tech neck, you may have heard of it as text neck, you may have heard of it as backpack neck, all of these things, they create what's called a pathological tension on the spinal cord. So if you're watching on Facebook Live, or you're watching on Instagram, or if you're catching the Twitter feed right now, behind me I have a spine chart. And on that chart, it shows the side view of what your spine should like, the normal, if you will. Just like you have a normal blood pressure, just like you have a normal temperature, just like you have a normal pulse, you have a normal position of your spine. It should be 3 45-degree curves from the side. But unfortunately, what's happening today, because of our technology, I'm sitting in front of my laptop right now, and so if you're watching me on Instagram or on Facebook, you're noticing that I'm leaning into it. We do this on a chronic basis. The average American sits at a computer for 6 or more hours a day. 80% of Americans sit for at least 6 hours a day at their desk. And what this does, when you're using this technology, it retrains the muscles, ligaments, and tendons to hold this posture as normal. And then we go home and we prop ourselves up with pillows, or we sit on the couch and we watch television, or we get off and we take a break from work, or we go to the restroom and we take that 15-minute break and we look down at our cell phones, and it retrains all of those muscles, ligaments, and tendons, and it straightens out that what's supposed to be a 45-degree curve in our neck to completely straight. And when that happens, that's like straightening a banana in a lot of ways. It creates a pathological tension that stretches out the spinal cord by as much as 2 to 3 centimeters, over an inch in length, stretching out the spinal cord. And what they find is that tension actually kills the neurons in the anterior horn cells of your spinal cord. And I know that's fancy terminology, but basically it's a slow death. It slowly kills you. And if you wonder why, when God said in the Bible that he will limit our years to 120, and then Moses and Abraham and all these greats from the Bible, they lived to 120, 130, why we don't get there as well, this may be it. Because if you think about life, if you think about everything that you do, and this is me, this is all my patients, we all are constantly looking down or stretching forward. And what we find in the research is that when you have lost this curve, it can decrease your life expectancy by as much as 20 years, regardless of all other risk factors. And then you go in and you add in our inflammatory diet and our sedentary lifestyle, and all of these factors, they start to build up, and they're leading to these chronic diseases. And one of the biggest problems with this isn't just that it's creating a straight neck and creating that pathological tension, but for every inch that your ear goes forward from your shoulder, it adds 10 pounds of pressure right here, right at the base of the shoulder, right where that cervical curve stops and goes into your thoracic kyphosis, or your thoracic curve. And the top part of that thoracic curve, it is the part of your spine that is supposed to surround and protect the nerves, the nerve roots, the spinal cord, as it sends out signals going to your heart. And the number one cause of death in the United States right now is heart disease. And so many people that are living with chronic disease, living with heart disease, living with all of the risk factors for heart disease, they think it has to do with genetics. And when I was at the Huskers game this weekend, or lack of a game, this was one of the things I was looking for. And it's not something I go out and I do on purpose, but I was looking at the people surrounding me, and it was just appalling how many of us have this chronic forward head posture, this tech neck. People sitting out there with their ear about 2, 3, 4 inches in front of their shoulders, and they look relaxed, they look calm. But when you look at the statistics on how many Americans have high blood pressure, how many of Americans have high cholesterol, that have the abnormal blood levels for a lot of conditions that indicate heart problems, then that doesn't surprise me at all. Because I can look at someone in the shopping mall, I can look at someone in the grocery store, I can look at somebody who's trying to watch the Huskers whoop the Akron Zips or the Colorado Buffaloes, and them watch it and them get up on their feet and cheer, and I can see heart disease building in their body because of the physical pressure caused by cervical degenerative myelopathy, caused by their tech neck, caused by how forward their head is from their shoulders. And unfortunately, there is very, very little that you can do to correct this on your own. Yes, you can start sleeping in the right position. Yes, you can stop spending so much time on your technology. But unfortunately, you've trained this over years and years unknowingly. And so these habits are hard to break. And so you need someone to come in and help you with that. And that's exactly what I'm here for, because Americans are sick and they are suffering and they are dying of conditions just like tech neck. And they have no idea. Even scoliosis, and scoliosis is one of those conditions that your health care provider, whether he's a medical doctor, as a physical therapist, or an osteopath, he recognizes that if you have scoliosis of the spine, which from the front, your spine is supposed to be completely straight. If it goes even 10 degrees one way, you now have a scoliosis, and that decreases your life expectancy by between 14 and 20 years because of the tension that puts on the spinal cord and on the nerve roots. And so it's surprising to me how few people know that they have scoliosis. They come in for a little bit of low back pain. They're like, Dr. Jake, you're a chiropractor, you can help with back pain. And they're absolutely right. I may not be the one that heals the back pain, but when I take the pressure off of the nerves, the back pain starts to go away. And I see this every day. Everyone from Deb to Wendy, to Wendy's mom, to Wendy's sister, we take care of these patients on a day-to-day basis. And if you've listened into this show any amount of time, you've heard some of the stories, some of the testimonies. I had two patients last week that told me for the first time in their adult lives, they've been able to go without headaches because of the care that we provide here in our office. And the reason why they live without headaches is not because I'm an amazing healer. It's not because I give them an awesome adjustment. Yes, those things play a role in this, but the main reason that we're able to help them overcome their chronic health problems is because we look for the cause. And we look for the cause in the nervous system, because your nervous system is designed to is designed to control all function of your body. And when we're just talking about basic functions like your heart beating, your lungs breathing, a cut on your hand or your finger healing, for that kickoff last week against the Akron Zips, for that Akron kicker to kick that through the end zone, his brain had to send a signal all through his body to get it to coordinate all actions. If we cut off that signal at all, he doesn't make that kick. Heck, he doesn't even walk out of the locker room, because you cannot function 1 second without nerve signal going from your brain down your spinal cord and out the nerves to every organ, cell, and tissue in your body. It doesn't happen any other way. And I know that because if I cut your brainstem, that's exactly what happens, is the whole thing shuts down. If I cut the nerve going to your heart, the cardiovascular system shuts down. But if we just take the weight of a diamond of pressure, because you don't have a pair of scissors running around your body cutting nerves, what we have is a spinal column and individual vertebrae surrounding and protecting the brain stem, the spinal cord, and each of the nerve roots as they exit off. And that has a normal position. Like I talked about at the beginning of the show, straighten up and down from the front, 3 45-degree curves from the side. In that position, there is no pressure damage on your nervous system. But if you take one of those vertebrae and you move it out of position by even 2 millimeters or 2 degrees, that's enough to put the weight of a dime of pressure on your brainstem, on your spinal cord, or on your nerve root. And that weight of a dime is enough to disrupt the signal going through there by up to 60%. So that may not be an actual decapitation, but if that's sitting on your brainstem, that will absolutely affect the way that your body heals and functions. Because if those nerve fibers are not firing at 100%, there's no way that your body is healing and functioning at 100%, and there's no way you're healthy, because that is the definition of health. 100% optimal function and healing. And there's only one way to figure out if you have that curve in your spine, if your spine is straight from the front, and that is to get an x-ray, to have an exam and to take any necessary x-rays that would normally cost in a medical office thousands of dollars. And your insurance may or may not cover it. Most of you probably are still working on your deductible for this year, but I don't charge thousands of dollars in my office. I don't charge thousands of dollars for my radio listeners. Anyone who calls my office, they get an exam, they get x-rays, typically for around $130. But for the first 4 radio callers today, if you're ready to take action with your spine and make yourself our next Deb or our next Wendy, call 402-413-8825 right now, and I will give you a 50% discount off of the exam, off of any necessary x-rays. Likely the cost will be around $65. And so tell Gabby that you heard Dr. Jake on KFOR this morning on Max Living Radio, and you're calling to get that 50% discount. Don't call just for the discount. Call because you actually want the help to help transform your life so that your body can heal and function and you can accomplish the things that God has for you. I'm Dr. Jake Tucker, and we'll be back with more right after the break. Welcome back to Max Living Radio. Again, I am Dr. Jake Tucker here at Max Living Studios at Good Life Family Chiropractic on the south side of Lincoln. We're talking today about cervical degenerative myelopathy. Before the break, we talked specifically about how something called tech neck creates a pathological tension on your spinal cord, lengthening it, stretching it out by as much as 2 inches, and actually starts killing the neurons in the anterior horn cells, part of your spinal cord. And so this is not something that I want anyone to have to suffer through. But when I was at what should have been the game between our Huskers and the Akron Zips last Saturday, it was one of the things that I noticed and tried to stop noticing because it was everywhere. Every single one of us had some form or other of tech neck, and whether it was because we were actually looking straight down at our cell phones, which is not the way that we need to be looking at our cell phones, or if we were just holding our heads, and a lot of us looked relaxed. They were holding our heads about 4 inches forward from our shoulders, and it's just saddening because this type of thing, if you do not have a curve in your neck of 45 degrees, if you've lost that curve, then that can decrease your life expectancy by as much as 20 years. And that's the exact type of thing that I help with here in my office. And one of the major things that we see with this is we see a decrease in immune system function. And your immune system, that's the system that God put in our bodies to help fight off sicknesses, to help fight off diseases. And when that is depressed, it is more likely that you get the flu. It is more likely that you get cancer. It is more likely that you suffer with an autoimmune condition because your immune system is not focused on the right thing. It is not firing at 100%. Remember, all it takes is the weight of a dime of pressure on a nerve root, spinal cord, or brain stem in order to depress the function of your nervous system. And the nervous system directly controls your immune function. For the white blood cells to be able to go find a bacteria inside your body, the nervous system has to tell the immune system where it is, and it has to tell the white blood cell where to go and how to get there and which type of white blood cell needs to be there. If that is disrupted at all, your immune system does not heal and function the way that it's supposed to. And then you end up with these chronic autoimmune conditions. Some of the most common autoimmune conditions that Americans deal with are things like rheumatoid arthritis, things like, and a lot of these are inflammatory arthritis, but we can actually blame type 1 diabetes on it's an autoimmune condition. It's a condition where your immune system starts attacking your own body or attacking healthy cells within your body because it doesn't know what it's doing. It's either overactive or it's underactive, and it's responding defensively, proactively defensively. And it's because of the way we live. It's because of the food that we're putting in our body. It's because of the technology that we surround ourselves with. And it's because of the posture that we put ourselves in chronically. We sit at a desk for 6 or more hours a day, and we look down at our smartphone. We look down at our cell phone. And these are things that stress our nervous system. And guess what? The chiropractic adjustment helps to deal with this better than just about any other treatment out there. In fact, there was a study done on HIV positive patients, AIDS patients as well. And this group, one of the major problems with the AIDS virus is that it suppresses the immune system. It actually goes in and it hijacks the cells of the immune system, and it keeps your immune system from being able to heal you from anything as simple as just a small cut that gets infected, and it starts getting worse and worse. And then something very simple like a cold can take one of these people because their immune system can no longer respond. Well, with one chiropractic adjustment, the immune system in these AIDS patients was boosted by over 169%. They went from a low immune system function to more than double that function with one chiropractic adjustment to the thoracic spine. And the thoracic spine does have a lot to do with the immune system, but it is nowhere near the most important part. The most important part of your nervous system is in your neck and in your brainstem. The brainstem right here, right at the base of your skull, it's designed to be the neurological center of your body. And when it is functioning at 100%, then your body is coordinating at 100%. But if it is off, even by the slightest amount, by 2 millimeters or 2 degrees, it affects the function of everything. And so an adjustment at the top of the neck, this is the one where you may have heard that getting adjusted can help with your blood pressure. This is the one that you may have heard, was the adjustment that chiropractic was birthed upon because it helped a deaf man hear again. And that's the power of the chiropractic adjustment. Not that it treats these things, but that it removes the interference from the nervous system, and the nervous system is then allowed to do what it was designed to do: heal your body and allow it to function at or near as close as we can possibly get to 100%. And so that's why we're doing the Super Immunity Workshop. It's called Lasting Immunity, Prevention is Powerful. And this event will be on Saturday, September 22nd, at 9 a.m. And we're going to be doing this at Christ Lincoln at the corner of 44th and Sumner. And this will be in the fellowship hall. And tickets for this event are on sale right now for $25. If we get to the week of the event and we haven't sold out, the cost for those tickets actually goes up because of how packed this event will be with information for you to be able to start making these changes. So early bird tickets are on sale right now for $25. If you call 402-413-8825, you can reserve your ticket to that event. And those tickets, those are going to be a free will offering for Christ Lincoln to help them in their ministry. They support ministries like the Lincoln Green Cheering. They support ministries like People City Mission, where I go every other Friday to give free adjustments to people that wouldn't be able to walk into my office. And so sign up now for that ticket. It's only $25, 402-413-8825. Call now, reserve your seat, and we'll make sure that you have all the tools necessary to not just fight immune conditions, but also things like cancer and diabetes, heart disease, and walk out of there with an action plan to start being proactive with your health. I'm Dr. Jake Tucker. Stick around. We'll have more right after this break.